Hi there, mask updates. If you want to know the latest, hang around and I'll tell you. Hi there, Dr. Brian here. I'm going to tell you what the latest evidence is released on the 18th of November from the more recent Danish study. And we're going to look at that and give you some helpful information about what decisions you make for you. So there might be some directives from the government or from wherever you live in the world. However, it's good to know from your own personal decision making about what might be the best course of action for you. So we talked a few weeks ago about the Lancet study, which was a review of all the available published information. Maybe there's more, but they reviewed a number of articles. So they didn't actually do any actual testing. They looked at what the previous articles had shown. And when I looked at that a little while ago, it was actually decided that mask wearing was equivocal for its results, partly because there was quite the compliance level and the use of the masks was very variable, and for them to be appropriately worn and worn continuously is very hard to accurately monitor and measure once people leave the confines of a lab. When they go out and go about their daily life, are they wearing them as consistently? Are they wearing them tight? Is there no air escaping? Is it not fogging their glasses? All of those sorts of things will determine whether the mask is actually going to be as effective as it could be. And that raises the question about, in any instance, whether wearing a mask is of as much value as we might think it is. Most of the masks that we buy are actually not designed to filter viruses and bacteria. They will tell you on the outside of the box that they're there to filter smoke and, dust and pollen. That's the usual filtering. And in a surgical setting, they're really just to stop you for spit coming out of your mouth and landing in an open wound. So if you cough or sneeze or even have a good laugh, you may have tiny fragments of saliva come out of your mouth, and that may or may not fall into a wound, and it may or may not be infectious. So in this Danish study, I'm going to read you the details of it and then break down what the findings were. Last page in the book. The results are really inconclusive, and the gap between might have had a benefit and might not have had a benefit is enormous. So much so that you probably wouldn't like to put money on the races if the odds were that bad. So the concept is observational evidence, which means what we think we're seeing. So we're not measuring it accurately, but we think it works. Like if everyone in the theatre wears a mask and no one gets sick, did it stop people getting sick, or was no one going to get sick in any event because no one was sick to transmit any bugs? So the observational evidence suggests that mask wearing mitigates transmission of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, which is not COVID-19, it's actually the previous one that was very much focused in the Middle East a number of years ago. It is uncertain if this observed observation arises through a protection of uninfected wearers or via reduced transmission from infected wearers. So the idea of protecting the healthy, or actually source control, so keeping the sick people keep the bug to themselves, or there was some combined effect. Now, so to assess whether recommending surgical masks outside the home reduces wearers' risk for SARS-CoV-2 infection in a setting where masks were uncommon and not among recommended public measures. April and May 2020 in Denmark. So the participants were adults spending more than 3 hours per day outside the home without occupational mask use. So they're not people who already wear a mask because they're a dentist or a doctor, or potentially use a mask because they work in a dusty or dirty environment. So So the intervention was encouragement to follow social distancing measures for coronavirus disease 2019, plus other no mask recommendation or a recommendation to wear a mask when outside the home among other persons, together with a supply of 50 surgical masks and instructions for proper use. So we're assuming that they're actually wearing the masks as they are intended. So the results, okay, the measures, the primary outcome was SARS-CoV-2 infection in the mask wearer at 1 month by antibody testing and polymerase chain reaction, PCR, or hospital diagnosis. So there were 3 ways they could measure, either by antibody PCR, which is magnificently unreliable, or a hospital diagnosis, which is probably the most reliable of all 3. You test positive to the antibodies even if you've not had this bug, but you've had a previous coronavirus bug, which is basically most of the forms of common cold. The secondary outcome was PCR positivity for other respiratory viruses. So they were also testing for other respiratory viruses that you may have picked up, but you could have picked them up any other way, I guess. And there's also some data that when you wear a mask, you reinfect yourself. So you can actually be your own source of infection because you're breathing bacteria and viruses back into your body. So there was 3,030 participants in the recommended to wear mask group and 2,994 in the don't wear a mask. So 4,862 completed the study. So a few people dropped out of the study. So in the group of 3,030, it occurred in 42 of the 3,030, and in the don't wear a mask, 53 recorded an infection. That's out of a slightly smaller group. So the numbers are fairly similar. So it was 1.8% of participants with a mask and 2.1% of participants without a mask. Now that's a difference of 0.3%. So that's the number that we're looking for. So they now say that the difference observed was not statistically significant.